So a big part of what I do from day to day is help people improve their smiles. And something that we don't really talk about too often is how we help people with their overall health. And they don't often realize how it's connected to their mouth. And sometimes things come up that we find that makes a lot of sense to people once we see that there's a problem going on. And there's a case I recently saw that I want to show you that demonstrates this. So this is a patient I've been seeing for quite a few years, and I've never been able to get him to allow me to take a CAT scan. He's always said that everything feels fine, no problems, anything, so he's always put it off. And this last time we came in for his checkup, everything looked good, and I just asked him, I said, okay, how are you feeling? And he said, I'm good, but just been having this sinus infection for a really long time and can't seem to kick it at all. And I looked at his chart and I saw that he did have one tooth that had a prior root canal on it. And I said, you know, we've talked about this before, but I really think it would be smart to get a CAT scan just to double check and make sure everything's okay. And let's get up in there and check your sinuses, see what's going on. So he agreed to it. And when we got in there and took a look at it, it's amazing, but you'll see this little dark spot here up on his left side, right next to that tooth with a root canal on it. And up on this top image, you can see it's got this huge dark area at the end of this tooth with the root canal. So he'd been dealing with a cyst, a big infection, up along the top of that root canal for a long, long time, and it had actually grown to the point where it had gone through the side of his jaw. Let's show you here. In this other view, it had gone through the side of his jaw. You can see this hole here is blown through the side there, and it had gone through the inside of his mouth there, and it had gone all the way up through into his sinus. So it's no wonder he's been having a sinus infection for so long. You can see that hole, it just tunnels all the way right through where that big infection has just been sitting there festering. You know, this top image you can see here is just blown right through up into his sinus. And those can be potentially life-threatening, so luckily we were able to get him on some antibiotics, the right antibiotics, but also we had to extract the tooth, take that out, remove that cyst and that infection in there, clean that up, put a bone graft in there, and eventually we'll get it restored with an implant and get his tooth back in a good place there.